President Donald Trump today declared a public health emergency to combat rising opioid abuse.
We can be the generation that ends the opioid epidemic. We can do it.
The move lets states shift federal dollars to drug treatment and prevention, but it stops short of putting new money toward dealing with the crisis. In Minnesota, 376 people died from opioid overdoses last year, nearly half of them from painkillers and more than one-third of them from heroin. Esme Murphy joins us now with local reaction to the president's proposal. Esme?
Well, Frank, I can tell you the local reaction ranges from praise to outright criticism. The sharpest critique is coming from the State Commissioner of Health, Dr. Ed Ellinger, who said the president's proposal does not appear to, quote, provide the right mix of funding and resources to have a significant and lasting impact. The president's proposal calls for better training for prescribers and a massive advertising campaign aimed at prevention.
We are going to overcome addiction in America.
Among those attending the president's announcement, U.S. Senator Amy Klobuchar.
Well, I think it's very important that the President of the United States acknowledge the gravity of this epidemic, and he did do that.
But Klobuchar, who has sponsored anti-opioid bills, including requiring a federal registry for prescriptions, says she would like to have heard more specifics, including new funding.
But I always believe actions speak louder than words. So what's really going to matter to me is what he does over the next few months.
Lexi Reed Holtom, who lost her fiancé to a drug overdose and helped found the Steve Rumler Hope Network, also would have liked to see the president promise more federal dollars.
Statistically, we are looking at, if we do not allocate appropriate funds and resources to address this crisis, we are looking at, by 2027, we're going to see 93,000 deaths a year, minimum.
But Republican State Representative Dave Baker, who lost his son Dan to a drug overdose, is praising the president.
I'm happy that he made the announcement. I'm happy that the declaration has been now made. I'm hoping that funding will come later.
Now, Senator Al Franken this afternoon came out with a statement expressing his disappointment at the lack of new funding in the president's plan. Senator Franken also announced he is sponsoring new legislation that calls for spending $45 billion over 10 years on both combating the crisis and on research.
It's a lot of money.
Absolutely.
I know there was a state plan suggested today as well, Esme. What's that about?
That's right, Frank. Governor Mark Dayton today announced a proposal that would require drug companies to donate a penny for each opioid pill prescribed in Minnesota to a fund that would fight opioid abuse. That legislation, though, would have to be approved by the Minnesota State Legislature.
A lot going on.
Absolutely.
All right. Thanks, Esme.